Most people with joint pain are told the same thing. You're bone on bone. It's just wear and tear. At some point, you're going to need a replacement, etc. But what if I told you that the body already knows how to heal that damaged tissue? And there's a therapy that gives it exactly what it needs to do that job. Now, this is a personal story for me. A few years ago, I tore the labrum in my shoulder, and as a chiropractor and a functional medicine doctor, I know what the standard of care looks like. It was surgery, immobilization, months of rehab, and really no guarantee that I'd get full function of that shoulder back. So I chose a different path. I treated my own shoulder with regenerative medicine, and today I have full function. There's no surgery, there was no downtime worth mentioning, but I didn't just stop there. My wife and kids use regenerative medicine to help modulate their immune systems from autoimmune issues that they have. This isn't something that I recommend from a textbook. This is something that my own family actually lives. And after 20 years of doing this in clinical practice, I've seen results that honestly, if I told you the details, you might accuse me of making them up. So I'm not going to promise miracles, but I'm going to explain to you why this works. Because once you understand the science, the results start to make a lot more sense. And here's what most people don't understand about joint pain and arthritis. The standard medical model treats inflammation like it's the enemy. So they give you the anti-inflammatories, the cortisone shots, and eventually surgery, but inflammation isn't the problem. Unresolved inflammation is the problem. There's a difference. Your body uses inflammation as a signal to begin healing. When that signal never turns off, when healing never completes, the tissue breaks down even further. See, cortisone suppresses the signal. It doesn't fix the tissue. It's like pulling the battery out of a smoke alarm while the house is still on fire. So what does stem cell therapy actually do? Well, your body has cells whose entire job is tissue repair and immune regulation. They're called mesenchymal stem cells. The problem is that as we age and after significant injury or in chronic inflammatory states, the body doesn't have enough of them in the right place at the right time. So what we do is we introduce a concentrated source of these regenerative cells directly into the area that needs to be healed. We use ethically sourced umbilical cord derived stem cells, not your own cells, which may be aged or depleted, but young, highly active cells that carry powerful regenerative signals. Our medical staff delivers them with precision. For joints, we use ultrasound guided injections so we can place the therapy exactly where the damage is. For systemic conditions like autoimmune symptoms, inflammation, or chronic fatigue, we use IV infusions so that the cells can travel through the bloodstream and address the multiple systems at once. So what happens next? The stem cells don't just replace damaged tissue. They communicate with your immune system. They reduce the destructive inflammation. They signal your body's own repair mechanism to get back to work. So think of it less like a transplant and more like sending in the best repair crew your body has ever seen. This approach works best for people dealing with osteoarthritis in the knees, hips, or shoulders, cartilage damage or joint degeneration, chronic tendon or ligament injuries that won't fully heal, post-surgical joints that still aren't right, and autoimmune-driven joint inflammation. Now, I want to be straight with you. This is not a magic pill. Not every case is the same, and results vary based on how much damage is present, how long it's been there, and what's driving the inflammation in the first place. That's why we don't treat everyone the same. We look at your case specifically, your labs, your history, your lifestyle, and we build a plan around what your body actually needs. So if you have been told your only option is surgery, or if you've been managing pain for years and you're ready to try something that actually addresses the issue, click the link below or reach out to us and schedule a regenerative medicine consultation. We'll walk you through your history, review any imaging you've had done, and tell you honestly whether stem cell therapies would be a good fit for you or not. And there's one more thing. You don't have to live anywhere near us in Idaho Falls to work with us. Consultations are done over the phone via telehealth. We work with patients all over the country. Wherever you are, if you're ready to get serious about getting well, we are ready to help. Your body has a remarkable ability to heal itself. Sometimes it just needs the right tools to get you there.